Actually,
Okay.
I'm listed as the host, so I just turned it on.
thank you,
Okay,
Mark.
great. Wonderful. Well, welcome everyone. We're so delighted that you decided to join us today for our virtual open house session, where we'll be talking about our graduate programs in population health management. Mark, if you want to advance to the next slide, we'll just spend a few minutes introducing ourselves. So I'm Dr. Elizabeth Topper. I'm a faculty member here at the Bloomberg School of Public Health. My academic home is the Department of Epidemiology, but I'm also serving as the director of our online programs for applied learning, or our Master of Applied Science programs, of which the population health management programs are part of that family. And I'll let my co-presenters introduce themselves as well.
Great, I'll go next. My name is Mark Bittle. I am a faculty member in the School of Public Health. My home department is Health Policy and Management. I've been with the School of Public Health about 7 years now, and was the founder, if you will, of the Population Health Management Program, and I'm currently the program director. And prior to that, I spent about 35 years of my career in healthcare administration. So I come to the table with a good bit of experience, and that we've kind of built that into our program. And I'll introduce Dave.
Hi, good afternoon, everyone. My name is Dave Grant, and I'm a current year alum of the program. I'm serving as the Chief Operating Officer of Keystone Health in South Central Pennsylvania. I think we'll get to my bio a little later on in the presentations. Thank you.
Great, thank you both. So just to give you all a roadmap, we've prepared a brief presentation for today to introduce you to the programs. And this is our agenda listed here. And then after we go through the presentation, we'll have an opportunity for some Q&A. So Dr. Bittle will provide an overview of the industry in general, and then more specifically, we'll move on to details of the programs that we have, including the curriculum, our philosophy and our resources where online learning are concerned, talk a little bit about our faculty and our alumni. David is not our only alum, so we'll talk about our alumni as well. And then we'll go into some of the more sort of nitty-gritty logistics regarding admissions requirements, financial aid, and like I said, we'll have time for question and answer at the end of the program.
Great. Well, thanks, Liz. So I wanted to just provide everyone just some brief background as to how this program came to be. And of course, if you're in the healthcare space at all, or even in public health, you know that we have a very high cost, fragmented healthcare delivery system that's largely focused on the acute care, medical care side of things. We do very little in the prevention and wellness space. And so, as I mentioned, I came out of healthcare after 35 years, joined School of Public Health full time, and one of the first things that I wanted to do was start thinking about how we could provide a bridge, if you will, between population health, public health or population health, and the healthcare delivery system to help break down these silos that we have in our current focus on acute care delivery system development, and really think about how we can expand beyond the four walls of our health system. So we've seen payment systems sort of moving us in that direction. These value-based payment models have really encouraged hospitals and health systems to start thinking more broadly about their patient population, but they still haven't gotten to the point of really helping organizations to think outside the four walls, particularly around the notions of social determinants of health and how to better begin to partner with organizations outside the health system to really address the drivers of poor health or the burdens of illness that we see in our communities. So this program has really been designed to help facilitate that learning and that conversation. So our focus is on population health management. When this program was launched, our first cohort was admitted back in 2017. We've graduated 4 classes of students now, David being one of them, the most recent one of them. We have some 190 alumni out there, both with certificates as well as the master's degree in population health management. So as the #1 school of public health, we're very proud of the growth of this program and how it's sustained itself over the last almost 5 years now. But we're also more proud of the fact that we've just recently been certified as a population health management program by the Commission on Accreditation for Healthcare Management Education, or CAME, as we call it. We see this as a very interdisciplinary program. It's really, again, sort of blending the public health with the healthcare administration. We use in our program both full-time faculty like myself and others, and then we also tap people in the industry who are working full-time in the population health management space and are contributing to our program by teaching courses for us as adjunct faculty. So we look at this as being both bringing in the experience that people have in the industry, as well as bringing in the evidence and merging those two together. It is very interdisciplinary, as you'll see when I talk about the faculty makeup, but our program represents most of the departments in this school. So as I mentioned, we sort of look at the core elements of public health. As you see on the left-hand side of the slide, we match that up with this triple notion of the triple aim, and looking at how we can not only help people understand the importance of reducing per capita expenditures and improving the quality of care, but also then focusing on that improved health side. And that's where I think we really bring the public health aspects of understanding social determinants, understanding the importance of collaboration and collective impact outside the four walls of the hospital, understanding the importance of these partnerships to really address social determinants, these drivers of poor health, so that we can, truly improve population health. And our definition of population health is both looking at your attributed population, those patients that are in your health system, and you've stratified them in multiple ways, and you've targeted programs around them to improve their outcomes. That's really the notion of behind value-based care. That's really what value-based programs are trying to do, is get those outcomes improved, reducing the per capita costs through your integration efforts, again, improving quality through your care coordination efforts. That's what value-based programs are really designed to do, but they really stop short of going the next step. And the next step from our perspective is really this idea of population health, and it's looking at the community as the population, not just the patient population. So it's bringing those two elements together, which are absolutely necessary. So we've designed a curriculum that we think is very appropriate for understanding the idea of population health. Again, it sort of merges the health administration side of things with the public health component. So as you can see here, our program for their certificate in population health is basically accomplished by taking these 8 courses plus a couple of the early ones that are 0 credit that are required. For example, the academic and research ethics is required for all the programs. But we start in year 1 with essentials of population health. We look at the principles and application of advanced payment models. In the essentials of population health, again, we sort of define what our program looks like. We talk about the core elements of our program all the way through the second year, giving you an understanding of the kinds of things that are important to know and that you'll be learning in the program. The Advanced Payment Models course really focuses on how we could use payment models to leverage or change behaviors that are going to allow us to improve the health in our community. We then go into the second term. You would take a collective impact course and an accountable care quality course and effectiveness course. So the collective impact course is really about how do we partner more effectively with our community partners, community-based organizations, faith-based organizations, public health systems to really work together. And this is, I think, largely designed for hospital folks who may not be as used to working outside of the 4 walls as perhaps their public health counterparts are. But really, it's creating a framework for which or by which these individuals can come together and focus on community health types of activities. The accountable care, assessing quality and effectiveness is really about how do we measure quality and effectiveness in this space of population health management. We have the students in third term take population and consumer health informatics, so understanding how to use data in a meaningful way to make improvements. We have introduction to EPI also, which we think is very important to understanding populations and population health. Fourth term is statistics, and then managing health across the continuum. So again, we think it's important to be able to understand statistics and knowing when you're making meaningful improvements, statistically significant types of advancements. And then the managing care across the continuum is really understanding how do we manage care truly across a broader continuum, not just within our hospital and health system and the component parts therein, but more broadly into the community. How do we engage community health workers, and how do we use that as part of our means to improve health and prevention and wellness as part of that, larger continuum. So by completing those 25 credits in the first year, you could earn a certificate in population health management. If you're applying to the program, you have the option of applying just for the certificate, in which case you would complete the first year, or you could apply directly to the master's program. I encourage students to apply directly to the master's program. You're not obligated to complete it. So after the first year, if you've completed all the courses required for the certificate, you could stop there. But if you apply for their certificate and decide that you want to go on for the master's, it's another application process. So you're just as well to apply to the master's program. So those are the 4 courses. You have up to 2 years to do that. So we show it as 2 courses per term, and we have 4 terms, but you can complete that over 2 years, meaning you could take 1 course per term for 2 years to complete this first year curriculum. This slide then shows the second year curriculum. So if you are going on to get the master's degree, you would begin taking courses in the bottom half of this graphic in year 2. It's year 2, quote unquote, because you have 2 years to complete that. So overall, to get your master's degree, you have 4 years to complete the program. You can do that by taking 1 class per term over a 4-year period of time. So we go on to much, sort of deeper level courses to build your knowledge around population health management. So we have applied concepts for high performance organizations. So what does it really mean to be a high performing organization? How does that apply or can be applied to creating a population health management strategy for your organization and your community? We start looking at specifically around health behavior and ways to impact health behavior. So that's another course. Organizing public health, a systems approach. Again, we think it's important for students to understand the big picture, looking at system level types of changes rather than focused programmatic types of interventions, which we're typically very good at in our hospitals and health systems, but we often fail to see the big picture and really make more systemic types of changes that are necessary in our communities. Behavioral economics and risk. So again, we're looking at ways to manage risk and how to leverage what we know about behavioral economics to create incentives around performance improvement, around health improvement for populations. We talk about the built environment and the important role that understanding and leveraging the knowledge there is to building a healthier community. We also have you take value-based concepts and socially responsible leadership. So what does it mean to lead these community types of initiatives? We talk about collective impact as a framework for improving our abilities to work with partners in the community and collaborate around these large-scale types of social change. But what does it mean to be a leader in that space? So we have a course focused on leadership. And then in the 4th term, sort of your final term of your master's degree program, we have a social and cultural basis for community and primary health. So again, looking at various aspects of healthcare in the community, in primary care, and then you would complete as your final requirement to graduate an integrative activity. Some programs call it a capstone. This is really that culminating event where you kind of bring together your knowledge and experience that you've learned over the years in your program and apply that to, in this case, a standardized case that we've prepared for students to work on. So it is, again, a culminating event. You have to pass it in order to graduate. but it is a wonderful opportunity for you to really kind of think about and apply what you've learned over the period of time. So as I mentioned, you can complete the certificate in up to 2 years, between 1 and 2 years, depending on how many courses you take per term. And you can complete the master's degree in as little as 2 years or up to 4 years. And I think that's, important concept. We've built this program. It's an online part-time program, so it is built for the working professional. And in just a few minutes, you'll hear from our alumni David, and he'll talk about his experiences in the program. But as someone myself who not only did their master's degree at night when I was working full time, but also did my doctoral degree part time while I was working full time, and raising kids and all those other things. So I brought that to the table. We really work hard as a faculty to make sure that we align our courses. So if I'm teaching a course in first term and we have another faculty teaching their course in first term, we work together to make sure that we're coordinating things, that we're not doing things that are going to create conflicts for the students. So we really do try and organize our planning for the course each term that we offer courses to make sure that it's streamlined and efficient, to make you as streamlined and efficient as possible as a participant. So it's part-time, 100% online. We really do build on this notion of group learning and peer learning. So you're not only learning from us, but we do have opportunities to learn from each other. The students that join our program typically are coming, all of them are coming with some number of years of experience, and they're looking to enhance their knowledge and abilities in this particular space of population health management. And so it's a great opportunity through group work. We do have online group work, and it allows you to work and learn from your cohorts. And I think one of the most impressive things that I've seen over my time, as program director, really since the inception of this program, has been how close the cohort becomes. So when I see them for graduation, it's probably the first time I'm seeing them in person. But it's amazing to me that as I see them online, and we have, online sessions like this, even in our online classes that are live talks, how well the students come to know and respect each other and what they know. So again, our model is really built on giving you knowledge, content that's evidence informed, evidence based, but also allowing you to access your peers through this process, through the course process. It's also very skills oriented. So you heard at the beginning, it's a master's of applied science. So we really do focus on this idea of being applied. So we want to be able to give you content that you can take from the class today and apply it tomorrow in your work. And some of the best emails that I've gotten from students that are going through this program is like, I'm dealing with this right now. This has been so helpful. It's helped me to really, address an issue. Or we just, talked about this in a meeting, and, and here we are talking about it in the class. The faculty are very open and accessible. So, I have students saying, hey, this is what I'm working on, projects that I have going on at work. Do we have any resources, or do you know of any other resources available? So again, we're there to help, you throughout this process and even after as you graduate. A ton of careers in population health management. 5 years ago, when we were, laying the groundwork, or 6 years ago, actually, when we were laying the groundwork for this program, before it launched, there were 2 programs essentially in the country that were offering this kind of program. And we were the first one that was really focused on population health with the big P, as opposed to the small p population of really looking at attributed populations. And so, part of our goal was really to help educate, particularly those in the healthcare space that were beginning to tread into this notion of population health. What is it? 6 years ago, I remember just leaving the health system that I was working for before I came to the School of Public Health, and I could tell you, they didn't know what a social determinant of health was. It wasn't in their lexicon. They never talked about it. But because of some of the changes in payment methodologies here in the state of Maryland, they started to have to think about them. And so again, this program really grew out of what I thought was a need for helping people to understand this space. So we have a wide range of students. We have physicians, we have administrative types like David, CEOs of hospitals. We have people from pharmaceutical industries. Many of them now have population health departments. Many quality departments, many hospitals now have population health management departments, again, that have evolved out of their care management structures. So there's a wide range, social workers, public health individuals in this program. We think it's very applicable if you're coming from public health and wanting to learn about population health, or you're coming from healthcare wanting to learn about population health. Many of our students have gotten, very significant promotions as a result of participating in this, because it's just such a growing area within the healthcare delivery space. Liz may talk about this a little bit longer. Dr. Topper may talk about this a little bit, but she mentioned that we have a lot of experience as a school in online learning. We've been doing it for a long time and really have invested heavily in making sure that the way that our content is delivered is meaningful, it's organized, it's accessible, it's reasonably standardized in the sense of where things are the same for just about every class. So it's easy to find your way around. If once you've gotten through one class, you pretty much have the process down for all the remainder of your classes. We work with media instructional designers to help us, develop our courses, to help make them accessible. A lot of tools available, so you're able to download our recordings as MP4. You can listen to them in any way you would like. You obviously can see them on your computer. You can download the transcripts, our slides. Everything is right there within our learning management system, and very accessible for you to learn at your pace. These are recorded sessions for the most part. The lecture part of it are recorded, voiceover PowerPoints, but there are different ways that different faculty, deliver their content. Some of it is through live talks like this, using Zoom. Others are, through the recorded lectures. But again, this notion of a hybrid model between the synchronous and asynchronous opportunities really do allow for engagement with the faculty. So myself as teaching some of the courses in the program, as well as accessing the students in your cohort. There is a 24-hour, 7-day-a-week help desk. Again, it's very responsive. If you do have technical issues, the courses are all monitored by the faculty and their teaching assistants. So I've never had a single complaint over the 5 years that I've been since the launch of the program with anyone having problems that couldn't be resolved very, very quickly. This is just a quick snapshot of some of the faculty. I mentioned one, that it's interdisciplinary. So at the bottom of the screen, you can see all the different departments in the School of Public Health that have provided content into this program. It's very interdisciplinary from that perspective. But also when you look at some of the faculty who are listed at the top, David Baker is a full-time practitioner. He's the executive director of population health for a large health system, and he teaches our quality course. He also serves on our admissions committee and is engaged in a number of different ways in support of the program. Ryan Moran is a recent doctoral graduate from the school, was my doctoral advisee, but he's a full-time CEO of a large, essentially federally qualified health center in DC, and he's teaching our Essentials Population Health course. Let's see, Megan Priolo works for CRISP. So if you're familiar with our regional information network here in Maryland, she's an executive there and is teaching part-time for us in our socially responsible leadership course. Alvia Siddiqui is the interim chief medical officer for Advocate Aurora. And is responsible for their population. She's the executive for their population health activities. They have a very successful ACO. So my point of sharing that with you is just simply to say that we have not only full-time faculty that are participating in this course and providing you content, but we also have working professionals in there as well. And now I'm going to turn it over so you can hear a little bit from an alumni, what the program is like from their perspective.
Thank you very much. I just want to say that review brought back some really great memories. And shout out to John McCready for finally breaking through me in statistics. It was a wonderful, we finally got there. So, but good afternoon, everyone. Again, my name is Dave Grant. I serve as the Chief Operating Officer of Keystone Health. We're a large federally qualified healthcare center in South Central Pennsylvania. And you can see my bio there. I spent, like Dr. Bittle, I spent many years in hospital administration. I was primarily inpatient. At the FQHC, we're all outpatient or ambulatory care. And as you can tell by some of the dates on there, I guess what you consider more of a mid-career professional. And certainly I was able to really apply a lot of the lessons to what I do every day. So perhaps we can go on to the next slide. So why did I choose this program? As an FQHC, and I think, we'll talk about how you can tie this back to your daily work. We practice, in a sense, bits and pieces of population health every day. But I wanted the ability to try and bring it all together. And again, I'll get into that a little bit more on the next slide. But whenever I was looking for programs, and if I recall, this program may have presented itself first on LinkedIn. I had this desire to really expand my knowledge in the field. We're hearing about value-based care, even in the FQHC environment, accountable care organizations, and I really wanted to understand more about what that meant. And of course, for me, this was an opportunity to be part of an extremely distinguished academic and research community. As you know, the facade there behind Dr. Bittle, I took an opportunity to go to Baltimore to see it, just to get more connected to this school. And it's a great feeling just to know that you have that degree from the best public health school in the country. There were very few population health focused master's level programs. And I believe that's still true at this time. The faculty were extremely knowledgeable, and I can't overstate this. Whenever the faculty were really responsive, everything that Dr. Bittle stated, I found to be absolutely true, and then some. I was astounded at the ease of access. There were office hours. And so if there were some concepts that I just weren't sure about and you just wanted some additional help, we logged into office hours. And I found myself on several occasions one-on-one with the faculty, just having great conversations and expressing just how these different concepts come together. The course format with the live talks and industry leaders, the live talks we actually looked forward to those. On many occasions, they had industry leaders. In particular, I remember the CEO of a company called Absolute Care, which I believe started in Baltimore. Excellent exemplars of population health and how to really change healthcare in the U.S. And the virtual model was certainly working full time as the COO of a large organization like this. There's very little time at all during the day, and you can argue in the evenings. And I believe that this is my second online master's program. I completed a master's in business in 2005. And let me tell you that the technology and the faculty are leaps and bounds from where I was then. Collaborating with other students from around the country, I still, we graduated in May. Many of us showed up and walked for graduation. It was a wonderful experience. And we still keep in touch. In fact, just last week, I had a call with one of my fellow alum. And, we're routinely, pinging each other on LinkedIn, or we're trying to bounce concepts off each other. So it was the students and just the entire alumni network is phenomenal. I'm a pharmacist by training, which really is to say I still keep my license. I have been mostly administrative, but I've been able to connect with other pharmacists that were in the program, physicians, and those others in large swaths of the industry. Next slide, please. So if I can tell you just some tips for success, really embrace all that Johns Hopkins has to offer. Once if you join the program, you'll see that there are various community groups or organizations that you would have access to. If you have an opportunity to even just visit the campus, unfortunately, my program took place during the height of COVID. And so the buildings were closed, but I was at least able to get there and see the facade and take a peek inside the School of Public Health. So, but absolutely embrace everything that school has to offer. For me, time management was very important. But it's a struggle some days, as you know, especially if you're working full time and you have children at home. But be mindful of the deadlines. Nothing was unreasonable. There were no unreasonable deadlines. Some of the courses, they would open the course up so that you could work ahead. Others, for various reasons, would not. But nonetheless, there was nothing at all unreasonable about that. I'd mentioned the office hours. Absolutely take advantage of those. It was just, I found it a bit mind blowing that you could get one-on-one with one of the instructors, and it was just an excellent conversation. And I think, to be honest, I mentioned John McCready earlier. I spent a few office hours with him, and we finally broke through on biostats. It was great. Connect with your classmates. As I mentioned, I still have classmates that we routinely, I'll get a text here and there from a few that are either in the region or not, and we bounce things off each other. So that's very true that the cohort tends to stay close. Tie the program back to your work or your life goals. So, as when I first started at Keystone, our boss, my CEO, she'd asked me if I would participate on a group called Healthy Franklin County. And as I got into the program, sort of these light bulbs started to go off everywhere that this is collective impact. But could we do better? And so we have a lot of our community benefit organizations that meet routinely. And I was able to tie that concept, the collective impact framework, back to what we do every day. And I brought that to the group. And I think in some ways I was able to provide a little additional leadership and some direction to this very large group of community benefit organizations that really want to do well for this community. We didn't mention yet that I found the fact sobering, being in healthcare for all these years, that only up to 20% of a patient's health outcome is related back to their medical care. The other 80% are these social determinants of health that Dr. Bittle spoke of. And when you work where I do, you see that firsthand. And we've been trying to address social determinants. That was in some ways why FQHCs were founded. However, this program was able to really supercharge that for me, especially. And so now we are, since this program, we've joined an ACO. We're in some conversations with another ACO. We've hired, hopefully I'll get a thumbs up for this, and we hiring a small army of community health workers to go out into our communities and help and really help drive health outcomes, but from the standpoint of housing and food insecurity and domestic violence and on all of the other drivers of poor outcomes. So please try and tie it back to your work or your life's goals. I think you'll find that once you start the program, these little light bulbs will start to go off for you. And by all means, enjoy the learning experience. As I reviewed that set of courses that were presented a little earlier today, I can't tell you enough how it brought back a lot of great memories and just the learning. I guess you could argue I am a lifetime learner, but it really, really struck home for me and really brought back some great memories.
Great. Well, thank you, David. I appreciate it. And we'll have some time for questions at the end. But I just wanted to kind of summarize before I turn it back over to Dr. Topper. And that is, I think some things that I said earlier tied in with what David just said. And I just want to, again, bring them back together. One is this program's designed for the working professional, as David shared. It really is meant to provide you evidence-based, evidence-informed, practical ways of improving population health in your organizations, in your communities. So this idea of taking it back to your work is so important to me as the program director, and thinking about many of the discussions that we had as we designed the program was really about making this applied, that every one of our courses needed to give you a takeaway or several takeaways that you can, again, go back to your work and use. And then I think that the last thing is just really the value, not only of the degree and the program and the school that it comes from, but more importantly, I think, are the people in it, the students that you get to share classroom space with virtually. Those opportunities are just great to develop this network. And again, as a program, we're certainly one of the very few, if not one of the only two, that can say we have a network of close to 200 graduates from the program that you can connect with and continue to stay in touch with, as David has done. And again, we're trying to be very active on LinkedIn so that people can keep track of one another. And then finally, we want to be there for you. So as a program, as faculty, we really do want to make ourselves accessible to the students. It's not just listening to a bunch of recordings and taking some kind of an assessment at the end. That these courses are designed much like you would get them if you were sitting there in person, and particularly as it relates to access to the faculty. So we think that is just so incredibly important. And I'm so happy that, Dave was able to share some of those experiences. So with that, I will turn things back to Dr. Topper.
Thank you. And hi again, everyone. And I completely and wholeheartedly agree with all of those sentiments. And thank you so much, David, for sharing your perspectives as well. I'll just piggyback on what Dr. Bittle was just saying for a moment before I go into the details on this slide. So he and I, as well as Christina Potter, who's also on the call, who's our program manager in the OPAL office, we've all gone through graduate degree programs in a part-time online format. So we bring our experiences with us when we design these programs. We know that you're busy. We know that you work full time, and many of you have family obligations and community obligations and other things that are demanding of your time. And so we're mindful of that when we design these programs. So if that's a concern of yours, I'm so busy, I don't know if I'll be able to do it. It's a valid concern. I get it. We've all been there, but you can do it. We've built in flexibility and understanding. And I think a schedule that enables you to get the work done. So with that, I'll just share a few details about the logistics involved in applying for the programs. The applications are processed through SOFIS and SOFIS Express. So this is a common application format. I think it stands for School of Public Health Application System. So this is what many of the schools of public health use. And so SOFIS is for the Master of Applied Science program, or if you're interested in applying just for the certificate program, you would go through a sort of a pared down version of that, which is called SOFIS Express. We do require a bachelor's degree from an accredited college or university, as well as a minimum of 3 years of health-related work experience in order to ensure that you have the background necessary to succeed in the program. You'll also be asked to submit a current resume or CV that demonstrates your previous healthcare accomplishments. And it says 1 to 3 letters of recommendation on this slide because the master's degree application requires 3 letters, but the certificate only requires 1 letter of recommendation. And then, as you can imagine, we'll also ask you to write a statement of purpose or personal statement that demonstrates how the program is compatible with your career goals and your background. Why is it that you're interested in this program at this school at this time? And then for anyone who might be an international student, you'll need a TOEFL or IELTS test score to demonstrate English proficiency, because all of the courses are delivered in English. And any academic records from international institutions do undergo a course-by-course credential evaluation, which we can talk more with you about if that applies to you. And I'm clicking my arrow to advance the slides, not remembering that Dr. Bittle is driving the slides. Thank you. So we do review applications on a rolling basis. And so as we get them in, we review them and we make evaluations and make determinations and make offers of admission. So we do encourage you to apply early. Students start in the fall. I believe in the fall of 2023, the classes will be starting on August 28th. So that's the first day of the first academic term. So our application deadline is June 1st for the master's degree and July 1st for the certificate program. So these are the tuition and scholarship rates for last year, but we do update the tuition rates and scholarships each spring for the following fall. So because it's not spring yet, I can't tell you exactly what the tuition will be, but you can use this benchmark at about $1,200 plus per credit is the full tuition, but then we provide a scholarship to every student that covers a portion of that. And it's assessed on a per credit basis. So because it's a part-time program, there's no like bulk full-time tuition rate that you'll be paying. You simply pay per credit for the courses that you enroll in. And then we, we apply the scholarship as a credit to your bill on a per term basis. The application that you'll fill out for admission also serves as your scholarship application. So you don't have to worry about filling out any additional forms for the scholarship application. It will be automatically applied for anyone who's offered admission. And then beyond this scholarship, we do have the financial aid office for the Bloomberg School of Public Health, which provides assistance with federal and private loans. And so you can see their contact information here on the slide, and you're welcome to contact them directly to ask any questions. And with that, I'll say that this slide needs to be updated. So the admissions officer information on the left is not correct. So please, if you have questions, you can send them to OPAL, OPAL office@jhu.edu. And I'll say that again in case you were scrambling to find a pen and write that down. So OPAL is online programs for applied learning. So our email is opal-office@jhu.edu. And thank you, Christina. I see that you put that in the chat. These QR codes, however, are current and correct. So you can scan either of these. The one on the left, it will bring you to Sophus for the master's degree application. And the one on the right will bring you to Sophus Express for the certificate application. And I think that might be the last slide. Is that correct?
That is it.
Okay, excellent. So we thank you for your time. We have about 12 minutes left in the hour, and we are more than happy to entertain any questions that you might have.
Gabrielle, I see your hand up.
Yes. Hi, how are you doing? Thank you for that great presentation. My name is Gabriela Parala-Heslin. I work as a senior research coordinator for infectious diseases, and I'm a full-time employee. My question is about the tuition remission. I was thinking to study, or take the program as a part-time. What would be the best advice to maximize or budget out the tuition remission? Thank you.
Well, it depends on what the tuition remission amount is, but I know when I was working full time and taking classes, I could have, the tuition helped me cover, maybe 1 or 2 courses, but then the rest of it was largely out of pocket. So it really, I think, depends on how much that is. Not sure if that was a helpful response.
No, it was great. Thank you, Dr. Mark. And the last question. So for example, what if for some reason I cannot finish at the 4th year and like it takes like 1 semester more? Is there a penalization or something?
No,
Yeah, I can answer that. There's a process by which we can help you apply for an extension. So it would be a 1-year extension. So you would have an opportunity to, courses are taught, like this one is a 1st-term course and this one is a 3rd-term course. And so by and large, courses are offered once a year. So if you missed one, for example, you're not, because it's a part-time program, you're not required to be continuously enrolled. So sometimes life happens, right? And people have to take a term off, and that's okay, but then you won't have the opportunity to hit that course again for another year. So my office can help you to apply to the school to request a 1-year extension, and that happens. I won't say frequently, but not rarely. And by and large, those requests are typically granted. It's more a formality just to let folks know that you're going to need another year, and you put together a letter asking for the extension and giving a plan as to how you're going to accomplish all of the program requirements with the extra time.
Thank you so much, Dr. Topper. Appreciate it.
My pleasure.
That is a good point too. I mentioned the fact it's a part-time program. You do have the ability, again, if you have financial aid, that may complicate things because there's generally a requirement for 6 credits each term consecutively. But if you are not using financial aid, you do have the ability to, skip a term. Basically, if you have a big budget or a big project or something big coming up, you may need to take a term off. That's possible. And as Dr. Topper said, courses are offered in sequences, but that doesn't mean that, the next time around you couldn't take 3 courses if you wanted to, sort of catch up. So there's flexibility, again, because it is a part-time professional program.
Thank you, Dr. Mark.
You're welcome. Other questions? Questions for David? He's been through it and survived.
Indeed.
Well, while we're giving space for people to maybe think about questions, I will note that the OPAL office has 2 sessions a month where we're available for help. Sometimes, you don't have any questions, but then you think of them later. So of course you have our email address now and you can send questions anytime. We also hold sessions in real time on Zoom the 3rd Thursday of every month. We have a Q&A opportunity for people to, we're there on Zoom just kind of waiting, and it's kind of like open office hours sort of a format. So if you have questions, you're welcome to log in anytime between 12 and 2 Eastern. And we'll be there to answer questions, and the links to those are on our website, and maybe Christina or Ashley, you can pop those in the chat as well, if that's possible. And then we also hold application support sessions on the 1st Monday of every month at the same time, 12 to 2 p.m. Eastern time. So if you're going through the application process and you have questions specific to the application, we're there to help with that as well.
All right, well, it doesn't sound like there's any other questions, and certainly want to be mindful of people's schedules, and thank you all for joining. Dave, again, thank you for taking the time out of your busy day to be here. Really do appreciate your willingness to share your experiences with us.
Thank you. It was my pleasure, and I wish everyone in the group well.
All right, well, I think with that, we'll end the session. Dr. Topper?
That sounds great. Thank you so much, everyone.
All right,
You.
take care, everyone. Thank you for your interest.
Bye-bye.